Welcome to the Diva Details. Welcome to the Diva Details, where bold, confident women embrace life unapologetically. From love and sex to wellness and reinvention, we keep it raw, real, and powerful. No filters, no limits. Just fearless conversations to help you thrive. Let's dive in with Diva Mia and Diva Cat.
Hello, Diva Cat.
Hello, Diva Mia. How's it going today?
Oh, it's fantastic.
Yes, the sun bright, weather beautiful.
It's a great, happy day.
Yes. I'm
Lots
looking
of
forward.
joy in the world.
Yes, I love spring. Spring is like my favorite time.
You know what happens in spring? People start to look at their bodies and they say, oh my gosh, what should I do with this body? Do I need to nip and tuck a little bit here and there? Or should I fix something here and there?
Oh, I'm all about it.
Are you?
Oh, yeah.
We kind of overanalyze our stuff and then we start to say, what would I like to improve?
I think we try to just look at, we only look for the worst spot. You don't look at the good spot.
I think you're so right on that. We beat ourselves up and we say,
I know.
I know. But you know what? Sometimes it's good to improve areas though, too. I did like our discussion regarding some of the natural or the less invasive ways. I do have a friend that she's done a lot of different modalities and plastic surgery. And she says the only thing that really works is plastic surgery.
Is it really?
The other modalities are temporary. They're like a Band-Aid to the problem, whereas plastic surgery kind of gets rid of it completely.
Well, I talked to all my friends about it who had that done. They say it was the best thing ever.
I think so, too. And when you do plastic surgery, you get a permanent result. However, I will recommend you wait until you get to your normalized size.
Oh, yeah, you definitely need. So I have one friend that she was very big, like 3+.
Oh, wow.
Yes. And she did the sleeve.
Oh, so she did a sleeve on her stomach?
She did gastric sleeve on her stomach, and she stayed on her weight for like a whole year before she went to have the whole nip tuck.
Okay. And has she still stayed at the same weight?
Yeah. And she says she never been happier.
Yeah. I know a lot of people that have lost significant amounts of weight, whether it's from diet or exercise. I'm doing mine more from fasting and intermittent fasting and juicing. But a lot of people, when they lose the weight, they have excess skin.
Yeah. She said that's only, all the modality that we were talking about is temporary.
It is temporary.
And it's a lot of work.
It is a lot of work. And the reality is, guys, a lot of those modalities, they're expensive.
That's true.
And when you actually calculate the cost of plastic surgery, it's not that much more than some of those modalities. You're really just delaying the inevitable.
That's it. It's stay permanent as long as you don't gain all your weight back, though. You have to think about that. You have to change your whole completely habit.
Yes, you have to be disciplined and make sure that you don't change your weight more than 5 or 10 pounds. You're going to have to stay there.
Yeah. I don't know. A lot of people could be anti-plastic surgery, bad, invasive, whatever, but everybody I've talked to that they have work done and they loved it.
Yes. There are complications, though, that we're going to discuss today. So you have to be careful and you have to get the right surgeon for the job. As long as you're safe, most people have good results. Now, there are going to be side effects like anything. There's going to be complications you might have to endure.
Yes.
And there have been deaths from plastic surgery.
Oh, yeah.
People that have undergone liposuction and have died from it.
They died from heart attack, not from liposuction.
No, actually, they died from an infection.
Is it really?
Yeah, so you have to be careful.
Oh, wow.
No matter what you do, if it's a medical procedure, you have to be careful.
Yeah. I haven't done anything yet, but I'll tell you the truth, I am ready.
You're ready? What are you going to do first?
My arm.
Your arms.
Yeah.
Everybody has like a different spot that they don't like. So you don't like your arms because you've lost so much weight?
Yeah. I got so much weight, and I like to wear the short sleeve shirt.
Yes, especially in the summertime, right?
In the summertime, yeah. To me, if I get my arm done, I think I'm good.
Yeah.
Because everybody else I cover with my clothes.
Well, I think a lot of people start on their face.
Really?
A lot of people will start on their face. Some people start on their body, but at our age, a lot of people are doing their face and their neck.
Huh.
That's kind of the number one place I've seen people go. Because a lot of people get sick of doing the Botox.
For sure, yes.
And you can do a brow lift that gets rid of those wrinkles. Yesterday, I was at a med spa and I was getting an IV. And I have kind of dark circles under my eyes. And they have this stuff that they put under your eyes. It's called Easy Gel.
Mm-hmm.
And we didn't talk about that last time, so I'll give you a brief idea. So the Easy Gel is an injection of your plasma and your fat tissue, and they stick it and they make it into like a gel formation.
Mm-hmm.
And they basically inject it under your eyes in order to make the dark circles and the indentations go away.
Oh, wow.
It's like your own personal filler, so it's no chemicals.
Oh, okay. They use from your own plasma.
Yeah, so it lasts for 2 years. The cost is $1,000 per treatment, and they want you to do 3 to 4 treatments. So you're going to spend $4,000. At that rate, I could do a facelift for $6,000.
Right.
So why am I going to spend $4,000 doing my eyes when I can do a lot more with the facelift?
For something temporary.
For something temporary. So a lot of people say, why are you spending all this money? And I'm at the point now, too. I've done about as much as I can with the modalities that if I want more permanent results, it's time for me to look elsewhere.
Go for it.
The med spas are people's quick fix, and I think they're starting to dwindle because people are seeing that the results aren't permanent.
Yeah, go for it. I would.
People a lot of times will get their noses done. I think that's one of the number one things. People at any age will get their noses done. If they don't like their nose, they're getting it done.
Yeah.
So that's like a rhinoplasty, right?
Mm-hmm.
I think that's what it's called, rhinoplasty.
Mm-hmm.
And people will get them if they have a crooked nose or if their noses are too big. Everybody wants the little tiny noses.
Right.
Yeah.
I'll tell you the funny thing. My sister-in-law and her sister, I haven't seen them for 10 years before I moved here. And we went to, family dinner. Her and her sister walked in. I couldn't tell. I don't know which one is which because they went to the same plastic surgery and they already look alike. So now they have the same nose.
Oh, wow.
Yeah. So you got to be careful too.
Now you're going to look identical, like identical twins almost.
Yeah. I couldn't figure out which one is which till they start talking to me. Then I recognize the voice. And of course, I don't want to make it so obvious,
Right.
Shake hand to the wrong person.
Right.
Yeah. So that's another thing. Yeah. But the nose are so pretty. It is so pretty. Nothing perfect, right? To me, in my eyes, they are perfect.
Well, here's the thing with noses. When you change the nose on a face, it really changes the whole face.
You think so?
I think so. And I love my nose personally, but I do have a small nose. I don't want to change my whole face, but I don't have a big nose. So I'm not going to judge if you want to do that.
Right.
I just want to lift the skin and tighten it a little bit.
Mm-hmm. I love my nose. I don't like my eyes. That's why I did my eyes.
You know how people get the number 11 between their eyebrows?
Mm-hmm.
I only have the number 1.
Oh, so you have
I only have one. I only have one line. I want that kind of fixed.
Oh, go for it.
Yeah. So people will do a facelift. They'll do a brow lift. I know people are doing eyelid lifts too. You talked about that.
I did my eyes, yeah.
So how did you do? Was that plastic surgery?
Yeah.
So that was your first plastic surgery?
That was my first one.
Yeah. So people do the eyelid lifts up, and they also do lifts underneath to actually get rid of dark circles too.
Mm-hmm. You could do that too.
So if I do a facelift, it'll be maybe that number 1.
Mm-hmm.
And then I don't think I need my uppers done, but maybe my lower under my eyes to get rid of that dark circle.
Well, when I had my eyelid done, so I have one eye like drooped down, so my eyes become very uneven.
Mm-hmm.
So I was thinking to look just one eye. He said, no, you look weird.
So they did both.
So they have to do both. And they also tie up the bottom. They have to do both. If you're going to go, you can't just do like the bottom and don't do the top and the top don't do the bottom.
They got to do both.
Because they look weird. They look unproportioned.
Got it. So they'll just lift it all.
Yeah.
Okay. And then some people will do a neck lift. I know I want to do that.
I think I'm coming up on that too.
Yeah. So the neck lift is nice because you realize you have as much skin on your neck as you do your face. And you realize if you have sagging skin on your neck, that it really makes you look older.
Yeah. So when I did my eyelid surgery, I was awake the whole time. The doctor was like, it's very, very, very small procedures.
For your neck lift?
For even the neck lift, the eye lift, or the brow lift, it's very small procedure, he said. And it was only an hour, and I was awake the whole time. We talked the whole time.
How long did it take for you to recover?
The next day.
And how much bruising was there?
I not bruised at all.
So you were ready to go the next day. Could you go out in the sun?
I went to the temple next day.
Oh, wow.
Yeah, I went to the temple next day, and he said at night you might feel like sore. You just keep the ice pad, and I was fine. Now, because some people did it without stitches. But my eye was I let it go for so long, so he had to stitch it up. So I had to go back 7 days to remove the stitch.
Oh, wow.
Yeah, so don't wait too long, right?
So you know how people are doing their nose? A lot of people are now doing their chin.
What they doing?
And they're making it more pointed. for women, and men are making it more of a masculine looking chin.
So you're looking for like the V shape?
More of a V-shaped chin.
Oh, okay.
And also when you do your neck, a lot of people are doing their jowls. You know how you get that little fat pocket on the bottom of your chin? They're fixing that with their chin augmentation too.
Oh, wow.
So there's different things you can do.
Oh, wow. We're going to live beautiful and healthy forever.
Yeah, you can look for young and beautiful forever.
Yeah, I was surprised when I was in that facility. There are men doing the same thing. They liposuction on their ab.
Oh, yeah. A lot of men are doing liposuction now.
Yeah.
There's fat they can't get rid of, and they're doing liposuction.
I was very, very surprised.
And you know, one of the things, too, is that different places specialize in different things.
Right.
So just because you have a plastic surgeon that did your facelift doesn't mean you're going to have the same plastic surgeon do your neck or them do your breast or your body, because they specialize. And you want to go to someone that specializes in that area because they're really used and they do a really good job.
Yeah, you have to do your research.
You have to do your research. And a lot of people start their plastic surgery in their 20s.
I know, I've heard that too.
Most people stop in their 80s, though. I will say it's like from 20 to 80 is your plastic surgery. Some do it for anti-aging. Some do it for symmetry, like your eyebrow or your eye.
Well, I don't know. I play pickleball with this lady. She is 85.
Really? And she still does plastic surgery?
She said she will never stop.
She will never stop.
She looks like she's in her 60s.
Really?
Yes. And muscular. She looked very strong, healthy 60-year-old.
So she's keeping her face in shape as she is her body.
Yeah.
And there's the other thing is people think that, oh, I need more collagen. One of the things that happens to the face that people don't talk about, it's not just the collagen that goes away for the skin, it's also the bone loss. So if you're not intaking enough vitamin D and D3 and K2, you're actually decreasing your bone structure, as well as you need calcium. You need the other vitamins like zinc and magnesium. All those things help keep your bone structure strong. So if you don't have those vitamins and nutrients, your face is going to sag more.
I need to. I'm guilty of taking vitamins.
Well, you got to.
Yeah, I had to.
Yeah. And some people are just doing injury correction. Like maybe you have a scar or you got injured. Plastic surgery is good for that too.
Yeah. I'm fortunate though. I don't scar.
That's good.
I was very fortunate.
That's good. So when you do your nose and your jawline and certain parts, you might even have some bone restructured or some cartilage removed, some fat removed or repositioned. It's a whole procedure.
Oh, wow. My friend just did her whole denture thing and it changed the whole shape of her face.
Oh, yes, it does. And you need to kind of know what you want when you go to talk to the doctor. You don't just go in blind and say, what do you think is best? You can, but you may not get what you want then.
Right.
I recommend seeing some pictures of different people, usually movie stars, because they've usually had a lot of work done, and figure out what you like.
Yeah. But some people choose, but it's personal preference. Some people choose to age gracefully, right?
They do. Yeah. And that's up to you.
Yeah, that's up to you. No, I would not look like grandma, no.
I will say some of the past procedures like the BBLs, the big butts and the big lips are
going away, isn't it?
It's going away very quickly. It's no longer it was a fad and now people are trying to slim it down.
Yeah, people just want to be looking healthy and muscular now.
They do. They want this healthy, muscular, refined look.
Yes.
I think the big lips and the big butts were fine during COVID, but now everybody's like, you know what? I want to get in real health.
Right.
And real shape.
Yes. Like the healthy looking, I think is the most really attractive.
Yes. You know, the thing is you're beautiful just the way you are, though.
Right.
And if someone is forcing you into plastic surgery to make you better, I would say that's not the right person for you. We do plastic surgery for our own self-confidence and because we want to improve us. If you have someone else forcing you into it, it's not the right fit.
Yeah, same thing is people telling you you're too fat, too skinny. No,
you do this for you.
You do it for you.
Because you want to change. You want to be different. Now, remember, you're going to have some downtime typically, not like Diva Cat over here.
No, the eyes procedure is very quick.
Yeah. Well, you may have some downtime. You may risk that they do one side more than the other, and you're now have to go back for a revisionary procedure. And you can also have scarring and nerve damage.
Right.
So there are complications when you do facelifts.
Yeah. I'm coming up to cataract surgeries, but that's really common for women, for people, anyone that over 60.
Yeah. Cataract surgery is a big thing.
Yeah. So.
But, you know, it's funny. They said vitamin D has been used to get rid of cataracts. high doses of vitamin D. There's actually some videos on that.
I know. I need to be better on taking vitamins.
You really do. And get away from the gummies.
Gummies, yeah. If anything doesn't come in form of gummies, I'm not taking it.
Well, the thing is those gummies, I don't know how good those vitamins actually are.
I think they have less percentage of that. You know,
they're like candy. It's like the Flintstone vitamins of the current age.
So you might have to take 10 to get like percentage of 2.
I don't know. Don't overdose on vitamins. Don't overdose. But definitely need to do your research because the quality of the vitamin is important too.
Yeah. Is it true? Is it really?
It is because some vitamin places use really bad ingredients. And a lot of those imported from other countries, I'm not going to slam any countries, but imported from other countries, they don't care about the ingredients. They just care about making the sale. So you might just be eating sugar pills with a little bit of vitamin in it.
I need to look at the ingredients.
You really do. You really do. I recommend getting vitamins that are made in this country.
Yeah.
Because they have higher quality standards on vitamins and you can do your research on which vitamins those are. And there's more and more companies coming back and making the vitamins here because they've had so many problems with tainted vitamins from other countries.
Yeah. Oh, wow. It's so much to worry about.
There's a lot to worry about.
You have to read the fine print.
You do. So up your vitamin D before your plastic surgery, up your vitamin, as long as it's okay with your doctor, of course, because I don't know your medical history. You may have a health condition that restricts it. But do your research. You may need more vitamin D. You may need more vitamin C. Fasting before procedure is great. Fasting after procedure, not so much. And then the cost. I mean, a facelift is like it can start around $2,000 all the way up to $20,000.
For the facelift?
For the facelift, depending on what you're having done.
Oh, wow.
If you do a full facelift with all kinds of intricacies, yes. And it will depend on the doctor you use. So typically, if you're doing 1 or 2 smaller procedures, if you're doing your neck, your nose, your eyes, your jawline, but it depends. So, every doctor's different. Every doctor has different procedures. I believe I was looking at the neck and I think it was $5,000 to $6,000 for a neck lift. Just the neck lift itself. But if you bundle it with other packages, sometimes you can get a better deal as well. I would say whoever does your face should be able to do your neck as well.
I pay close to $3,000 for my eyes.
See, that was one small procedure and it was $3,000. You can't get the same effect in modalities on your eyes that you got from that plastic surgery. I mean, I can't tell you did anything. Where did they cut?
The upper lip and corner here.
See, I can't even tell.
That's why he's
There's
good.
no scar.
Yeah, that's why he is good.
You'll have to give me his contact info.
Right, I could go for the $1,500 that I saw my friend and had the scars everywhere. I said no.
So you found a good one.
Yeah, I found a good one.
So facial surgeries tend to take 1 to 4 weeks to heal completely. You can have infections still.
Yeah.
You can have nerve damage just like you can anywhere on the body.
Yeah.
And you can bleed out too. You can have bleeding issues. So if you have any type of, let's say, like a bleeding disorder or if you're on medication, you have to be careful. You need to make sure that this is a surgery. So you need to make sure that you tell your doctor all the medications you're on, all the pre-existing conditions you have, and make sure they're okay with that.
Yeah.
And realize you may not like the results.
Yeah, they do clearance physical before you do all. You go underneath.
I like doing fasting before because it helps turn on some healing aspects of your body.
For sure, yes, that's for sure.
Yeah.
I fast the night before.
I recommend fasting for 2 or 3 days before, but that's just me.
Yeah.
That way your body's turned on and you've got stem cell production already going. So when you actually have the surgery, you'll have less inflammation.
You probably heal faster.
You do heal faster. I do that before every single surgery, no matter what surgery it's been. And it's very beneficial and the pain is less, especially since I don't take pain meds. So when you come out of the surgery, you'll have less inflammation and less pain. I require that since I don't do pain meds. I'll do pain meds for 1 day after surgery, and then after that, I go cold turkey, just because I can't deal with the pain meds.
Oh, I love pain med.
I know you do. If they could give me morphine and a pain med, I would take that.
I love my pain. Give me all my medicine.
Yes.
Zing on me. No.
Diva Cat's our drug addict. She's our local drug addict.
Yeah, he even gave me this volume the day before, but he was so stingy. He only gave me 1 the day before surgery.
Oh, he's stingy. I kind of like that when doctors don't overdrug people. It's probably a good thing, hon.
Yeah. I was like, what is this? 1 pill? That's not going to do anything. He said, believe me, honey, it's going to calm you down. That's enough. I said, okay.
Well, there you go.
Yeah.
I bet I could take a volume.
You think so?
I think I could be okay with that.
No, he prescribed me.
Well, they also have them over the counter. They have
What is
it? St. John's wort? That's what it is.
Really?
Yeah,
Is it effective as a doctor prescribed?
Probably not.
Yeah, see?
Well, and then the next thing that people do are your breasts.
Oh, I want to do that so bad.
I was thinking I wanted to do a breast lift, but I've been lifting so much weight that my breasts are very perky again.
Awesome.
I mean, honestly,
yeah. Oh, Diva Mia.
My chest is really perky now. My nipples have come up.
Oh.
And I don't think I'm going to do a breast lift. And I was really nervous because when you do a breast lift, they move the nipple. And a lot of people lose sensitivity in their nipple.
I've heard that.
And I do not want to lose sensitivity in my nipple.
Yeah.
Now, there are doctors out there that their specialty is to reconnect nerves.
Huh.
And that is actually a specialty. Now, you have to get in line and you have to do it right away after the surgery. So if you don't have sensitivity, you need to quickly get in to see the doctor. And the thing is sometimes the sensitivity takes a while to come back. So it's kind of like a double-edged sword. But the longer you wait, the more the nerve contracts.
Oh, wow.
For me, I just don't want to even mess with it.
Yeah, you don't want to lose that either.
I don't. Now, there's breast lift, right? That's just moving the nipple. That's if you have enough breast material. And you just want to move the nipple in a better location. Maybe you did a lot of breastfeeding and it sagged a little bit. Then you also have breast augmentation. Now, a lot of people have gotten implants, had problems, and gotten them taken out. Now, you can do a silicone implant or you can do a saline. And I've heard about both. Most people tell me the silicone is nicer feeling than the saline. It feels a little plumper. But people have had leaking silicone breast implants.
Oh, wow.
You remember the Dow Corning case back in the early 90s?
So where those going to go? It's like run all over your body? Going to pop up anywhere?
No, when it leaks, the fluid gets into your body and can lead to cancer.
Oh, wow.
So you have to be careful. I don't want to stick stuff in my body. That's my big thing. I don't have any implants.
Yeah, I think I'm good with what I have.
Yeah. And here's the other thing. You can also transfer fat into your boobs.
Wow. So they could cut from my belly, just inject to my boobs?
Well, they don't cut. They lipo it out, and then they inject it back in. Now, when you do a fat transfer, they tend to transfer 2 to 3 cup sizes up.
Okay.
So if you're a B, they're going to make you a D, let's say. But, and this is a huge but, B-U-T, not a B-U-T-T. This is a huge but. You're going to lose about a cup of it because your body's going to just, some of the fat cells are going to be dead your body's going to just process them out. So by the time you're done with your decrease of inflammation, your decrease of swelling, the fat that gets flushed out, you're only going to be about a cup size bigger.
That's why they do 1 extra cup size? Is that what you're saying?
Because some of it, a half to 2, depending on the doctor, a half to 2 cup sizes up. By the time you're done, it's going to shrink up a little bit and you kind of don't know if it's going to be perfect. And you might have to go back in for revision because maybe one side is bigger than the other.
Wow.
So with the fat transfer, it's a little bit iffier. That's why a lot of people opt for the implants. If you're okay going back for one more surgery for revision, then you can. Because I've looked into this extensively. That's why I know about this one. Because I didn't really want to do an implant. I said, I could take some fat from my ass and stick it in my breast. The problem is that now you may show up false positives on a mammogram because the breast tissue is going to maybe more fibrotic and hard in certain areas.
Okay.
And it may look like a breast cancer. So you might have a false positive breast cancer. They might have to go in and cut it out and then determine that. So there are complications with the fat transfer.
Oh, wow.
If you're younger and your fat tissue is not as metastasizing like that, you'll probably have a better luck. For me, I probably should not be doing it.
And with your luck, though, Diva Mia, you might have.
With my luck. Plus, I have lipoma issues where my fat, because of my liver, tends to make little hard nodules.
Right.
So most likely it won't work for me.
Yeah.
So if you have any type of liver or kidney issue and you do it, it's probably not the best way to go.
So you're thinking going to do the breast implant?
I'm not going to do either. I got big enough boobs.
That is true.
And now that they're lifting, I'm so good.
Yeah.
My boobs don't have to be perfect, but they do have to stay sensitive. And I'm okay with the way they are.
Yeah, I'm fine with mine.
Yeah. Then they have breast surgery for men.
I've heard that a lot.
So the breast surgery for men is to reduce when they get man boobs because men have too much estrogen. So men have been doing that just to decrease the man boobs when they have too much fat. It's mostly liposuction.
Okay.
It can be a little restructuring of the tissue. It can be even a nipple lift if they need it, depending on their breast structure.
Wow.
And then there's also breast reduction for women when you have too big of breasts that it's hurting you, like it's causing back pain or something like that. Now, I will say I haven't seen a lot of really skinny women with large breasts. So if you lose weight, you could also do it that way instead of going the surgery route.
Yeah, yeah. Wow, I didn't know men does the breast surgery.
Yeah, and when they have man boobs, yeah.
Oh, wow. I seen them do the liposuction to get their abs, but I've heard of those.
When they're overweight, because sometimes when men lose the weight, they keep the boob because it was an estrogen dominant thing that added the boobs.
I see what you mean.
It's just like another form of liposuction. So some people do it right. You know, a lot of people go in, I don't recommend this, but post-pregnancy to do a breast lift. I say post-breastfeeding is the best time to go.
What?
But if you're going to have more kids, I would recommend waiting till you're done having children because it can mess up your milk supply too.
Right.
A lot of people do it after weight loss. If you've lost a lot of weight, your boobs may be gone.
That's another thing.
I've seen a lot of women that get down to like 110, 115 pounds and now their boobs are gone.
I came from cup size C to A, Yeah. And I loved it.
You did?
Yeah, and I don't need any work done now.
Well, and some people just do skin tightening, right? They'll slice a little bit of skin off and they'll move it around a little bit.
Right.
You can do that too.
But now you say weightlifting is now.
Weightlifting? I'm telling you, look at these pec muscles.
Chest, yeah.
I'm beating my hand on my chest. I got some pec muscles, and I hadn't been doing a lot of chest presses because I had torn my rotator cuff, but it's been it's on the nicely healing on the mend. So now I've been doing it, and I was like, look at my chest. Yeah. I was showing off my pecs to my trainers, like, oh yeah, those look like some good pecs today.
You do.
I'm like, whew, yeah, I'm just going to work it that way.
Yeah, I think it's less invasive.
I already have big shoulders, so I've got broad shoulders, so it's all good.
It's more healthy way anyway.
Yes, and then you don't have to deal with the scarring or potential of like a implant bursting.
And the pain, I took care too of my friend when
after breast surgery.
After one, it was a boob lift, and one, it was tummy tuck. The pain they go through, I think I'll die from the pain. I don't know.
No, you'll be fine.
No.
Most people forget it like pregnancy pain.
No, the thing they go through the first couple of days, I think I'll die from the pain from heart attack or something.
No, you'll drug yourself.
Oh, yeah, you'll
just drug yourself so you can't feel anything.
Yeah, no, it just give me goosebumps.
The cost on breast lifts are about $5,000 to $15,000, depending on where you go. We're adding it up now, right? So if you
that's vacation.
Yeah, $5,000 to $15,000. Well, yeah, but the breast lift is permanent, and it takes about 2 to 6 weeks to heal.
Is it really?
Mm-hmm. You can have the same type of complications, I think, as your face. You can probably get an infection.
Mm-hmm.
Scarring's always going to be there. The thing with implants, you can have them burst, and then numbness. Your nipples could be numb. And here's the thing, my nipples are way too sensitive to even risk it.
Yeah, no, you don't want that.
No. Now let's talk about the procedure that every woman after having a C-section and multiple babies wants.
Okay.
That's the tummy tuck.
The tummy tuck, yes. But I think if you could go through, because I had a C-section, my doctor said, the guy that did my eyes, because I also asked him about my tummy tuck.
Yeah.
He goes, you have a C-section. You get through the tummy tuck piece of cake.
Yeah, the tummy tuck should be easy because they're not slicing through like to get moving your muscles around and moving your organs around to find the baby. It's just an external thing.
Yeah. He said it's just like a layer underneath your skin.
Yeah.
That's it.
And also they may stitch up your abs if you have the split abs.
Mm-hmm.
Yeah.
He said, you get through the C-section, you could get through anything.
Well, the tummy tuck is nice. A lot of times with the tummy tuck, they'll also do liposuction. In your stomach area, they might do liposuction in your back. So they might reach around your back. And sometimes when they do the tummy tuck, they do a tummy tuck 360 where they actually cut all the way around your sides and your hips to tighten your back as well.
Then you have a scar.
You'll have a scar. All the way around, yes. It's not a full 360. It's like a 270, but you'd have a scar most of the way around your body.
Oh, I don't know. I like that.
I don't like that either, but I've known people that have done it and they enjoy it. I did ask if they had like any skin tightening anywhere, and they said a little bit here and there, but they're only a year out, so they're still adjusting. But that's kind of the procedure. So they're going to do a tummy tuck, possible liposuction, and if you have split abs, they can tighten those up too. Now you have an option. You don't have to do the back procedure. You don't have to have them go all the way around. That's just an option. And that's only if you have a lot of sagging skin on your back.
I see.
But when you do, think honestly, if I did the tummy tuck, I'd want to do that first. And then if I needed to, go back and do the back.
Yeah, I would just stick with the front.
I like the front too. I think my back is tight enough.
Yeah,
I'll just weight lift my back.
You could lift. You could do the fly. You could do the butterfly to
exactly.
Up,
I have a nice V shape with my shoulders anyway on my back, so I kind of want to keep that. I don't want it to be too tight.
Right now, I don't want anything done. I'm good.
Well, there's the mommy makeover too, right? So if you do a tummy tuck, you could also combine it with a breast procedure.
Okay.
So it's tummy tuck, breast procedure, liposuction. Sometimes neck lift at the same time. Sometimes thigh lift.
Oh, wow.
And there are people that if they're getting a C-section done, they'll get the tummy tuck done right there on the table, right after the C-section.
They could do it?
They can do it for you. So you'll do the C-section and then immediately you'll do the
you schedule
tummy
it
tuck.
back to back.
You schedule it back same day, same time.
Yeah.
So they'll cut out the baby, the C-section's done, they take the baby, and then the plastic surgeon comes in. And he trims down your stomach.
Huh.
And on the tummy tucks, by the way, they do move your belly button. So your belly button gets moved. So if you have a sensitive belly button that has a little bit of an erogenous zone for you, because some people do, you may not want your belly button moved.
That is true. But then if you do right away, how do you know where your belly button's going to be?
They actually will show you. They will actually point out to where they're going to move it to. They can estimate that.
Oh, I see.
Yeah. It's going to take out excess skin. It's also going to take out excess fat. There is a limit in most states to how much fat you can have removed. Did you know that?
I did not know that.
Most states don't allow you to have more than 8 to 10 pounds of fat removed at a liposuction. However, when you're doing a tummy tuck, you have fat attached to the skin. So they can take actually out more fat because of that.
They'll probably be more permanent.
But they can only take, they can only take 8 to 10 pounds out with the liposuction, depending on the state you're in. And some states only require, allow 5 or 6 pounds.
Oh, wow.
So don't think that liposuction is going to make you skinny. It just won't.
Yeah.
On your arms, too. If you have extra fat on your arms and they cut the extra skin on your arms, they can take fat from there, too.
But I'm not sure I'm going to put myself through that pain. They said that, I read a lot about it. They said it's the procedures is easy, it's quick, but the recovery is very, very painful because your arm, you move.
You move, you're picking stuff up, yeah.
Yeah, that's why they said it's
I just wouldn't want the scar.
That line, you're going to get...
That line underneath, yeah. I wouldn't want the scar. But for the midsection, for the tummy tuck, I have already got the scar from the C-section.
Yeah.
So the scar is going to be right in the same place.
And you wear clothes cover it anyway. That's why it doesn't bother me.
Yeah, well, you're wearing a bikini. The only person that's going to see it is your partner, and hopefully they've already seen your C-section anyway.
Yeah, so, yeah.
Now, it is a longer recovery.
For what? Which one?
For the tummy tuck.
The tummy tuck.
The tummy tuck. So the tummy tuck is going to typically take you 4 to 8 weeks, and most people say it's 8 weeks. They have 2 different kinds. Well, there's actually more than 2, but we're going to talk about the 2 different kinds. They have a drainless tummy tuck and a drain tummy tuck. Now, the drainless is where they stitch you up so tightly inside that you don't have any fluid buildup.
Okay.
And so you don't need a drain. Some plastic surgeons don't like it because they say that it can cause dimpling.
Okay.
And it may. But so can the drain.
Yeah.
So either one can cause dimpling. And then the drain one is where for like a week or so,
you come home with a drain hanging up your belly?
You have this pouch coming up. I actually had to do this for a friend of mine. Actually had to empty her drain. And it's filled with fluid and blood. And it smells. Because, rancid, or it's not rancid, but stinky blood, Yeah. You don't have just one drain. You have multiples. So she had, I want to say 3 or 4. I don't remember specifically.
How long you have to do that?
Every 2 hours we would check. And then overnight, every 4 hours we would check. And we would drain it. And then you have to kind of press on certain areas to make the drains come out. And then you just dump it in the toilet. And then you have to measure because what they're doing is they're checking to make sure the fluids go down. And as the fluids go down in amounts, then eventually the drains can come out.
Okay.
Now, the problem with the drain procedure is the risk of infection because you have these basically drains that go into your insides for a week or more.
Well, if I ever decide to do this, I'm going to stay at the facility till all those things coming out.
They don't allow you to do that. No, when you do a tummy tuck, it's usually, they might keep you overnight, but that's going to be it.
So you come home with that pouch?
You come home with multiple pouches, depending on how the tummy tuck procedure worked, and whether you also did the sides and the back.
I wonder I would come home with a pouch too if I do my arms.
I don't think that's the case. I don't think there's a drain on your arms, but we would have to do the research. But
yeah,
I know there's a drain on your abdomen. There's no drain on your neck or your face.
That is true.
It's just because the fluid tends to build up in your midsection.
Around your midsection.
You have to be careful of infection.
Mm-hmm.
You have to make sure that you're sanitizing the whole area when you're cleaning up the drains, and you have to record all the fluids, just like you're recording all the pain meds.
Oh, okay. So you drain, you measure it. Okay.
Yeah. So the drainless, they won't do if you're too skinny.
Okay.
For some reason. Or if you have, it depends.
Huh.
And it depends. There's some doctors that don't do the drain anymore. And there's some doctors that won't do the drainless. So that might be, when you select your doctor, one of your deciding factors.
Well, I had the ACL reconstruct, right? I came home with that bulb.
Yeah, the bulb, yeah.
Yeah, let me tell you, the day when I go back, when they pull that thing out, there is the pain that when they pull that string out, oh my God. He pulled very quickly though, but it's still like, I thought I'm going to have heart attack, sharp pain right into my heart.
Oh, wow.
Yes, I never forget it.
So you would want to do the drainless as well.
If I do, I don't want anything hanging off me, no.
Yeah, I agree.
No.
There's going to be visible scarring, right?
Yeah.
And so you're going to spend between $6,000 and $15,000 on a tummy tuck. Maybe up to 20, depending on how much work you have done.
Wow. What if you could just eat good, be better, be healthy, and get skinny, you know?
A lot of times you're still going to have extra skin.
Yeah, around that, especially midsection.
Yeah, they say, and I've done the research on this too, they say it takes about 2 years after you lose weight, if you're maintaining a weight, for your skin to fully come back.
Mm-hmm.
And after those 2 years, if it hasn't come back, it most likely won't.
I see.
So what it is in 2 years. So if you want to wait 2 years to have your tummy tuck and you want to have less skin removed, then you can wait 2 years, and then maybe you don't have as much skin and less scarring, etc.
Yeah, so you get to your goal weight and you just keep working out for 2 years, and let's see, we'll take it from there.
Yeah, you just have to deal with a little bit of skin flaps here and there and tuck them in your pants, and hopefully your partner is understanding. But honestly, I think it's better to get the weight off than to have deal with the skin later than to have all that extra weight, just for your health in general.
Yeah, just for your health in general. I mean, any surgery is complicated. Could be, yeah.
You have to worry, just like on this, like with blood clots. The infection is the big one, especially if you have the drained. Yeah, that was the one thing she had to worry about, was the infection potential. And then scar tissue buildup, too. You might have scar tissue. You could get scar tissue from the drain area. Yeah, like you could have little hard spots.
Yeah. I don't know. I don't know. If I would have done it, I'll wait till like the drainless procedures.
Mm-hmm. I think so too. I think I would specially look for a doctor that does the drainless.
Yes.
And then there's the butt lift. So the Brazilian butt lift, we're not going to talk too much about because it's going out of style. The BBLs, the big, wide, people still like to have them kind of like plump, but the big, wide butts are kind of going out of style.
Just do your squat.
Yeah, do your squats.
Sit and squat.
Some people don't have butts. They'll get like implants like you do on your boobs down in your butt. I think it's a little much.
No, I don't know. I think it's, just do your squat and wall sit.
Well, and, most of the people that do the butt things are between 20 and 40 anyway.
Yeah, that's true.
They're a younger group. They like the big old butt. Baby. Yeah. We had that song. What was it? Sir Mix-a-Lot, Baby Got Back.
Baby Got Back, yes. Yeah. Those are in 20s or 30s. Yeah. I think in our age, I don't know, just do wall sit.
Yeah, or hip thrusts, right?
Yeah.
Hip lifts. So the butt lift can be, again, 8 to 15,000, and it's got a 4 to 6 week heal time.
Oh, wow.
So remember, you're going to be out during this time. You're not going to go to the beach. You're not jumping in the swimming pool. You're not going to the gym. You're taking the time to just rest and recuperate. And if you have a bad diet, it might catch up to you.
That's another thing too. 6 weeks of laying around, rest.
I know.
I will be eating everything inside.
Well, make sure your diet is clean. And that maybe you fast every other day or something. Just make sure your diet is clean before you do any of these procedures, or you're going to gain weight while you're resting and recuperating.
Yeah, I think changing eating habit is like game changer for me and my family anyway.
Yeah.
I mean, we would spread ourselves every once in a while, wedding, party, but for the most part, I think we're good. Yeah. I think that's the only way.
Yes.
Stay healthy. You are what you eat. We always say that.
You are what you eat. One of the best ways to go looking for a doctor is to check out the board of plastic surgeons. I think there's an American board of plastic surgery.
Mm-hmm.
You can go and you can look to see if they're certified. You want a certified doctor. If they're not certified, even if they say they are, believe me, you'd need to double check.
Right.
Because there have been many cases where people, I saw one in Florida not too long ago, where they said they were a licensed board certified plastic surgeon and they weren't even licensed.
Oh my God, that's happened in our Asian community.
Does it?
Right. This is like back in 15 years ago. People go to San Diego to do all these procedures because he accept all kind of insurance, all of that.
Yeah.
He was a fraud and he's not even the license.
Yeah. And then they may cause infections.
Yeah.
It may not be so clean.
Yeah. You might see it on the news. It was a huge thing 15 years ago.
Oh, yeah.
Mm-hmm.
Besides just being licensed, you need to find out if they're even good at the procedure that they say they're doing. Don't believe the before and after pictures.
Oh, no,
those a lot of times are photoshopped, and you could have a before and after picture because one procedure out of 20 worked well.
Right.
You can't really believe it. And a lot of times people in the neighborhood might give you a recommendation if a woman has done it.
Mm-hmm.
And she can kind of tell you what the bedside manner is. You can kind of trust online reviews, but they have to have a lot of them. So be careful with that too, because online reviews might be faked.
That is so true. Even between friends or friends, she might not have the same skin type like you do.
Exactly. And skin type might change.
Yeah.
People with darker skin may have more scarring.
Mm-hmm.
So you have to remember that.
Yeah. For us Asian, we keloid. You know what the keloid is?
Mm-mm.
When the scar, instead of fainting away, they bulked it up.
Oh, it bubbles up?
It bubbles up. That's very common from our...
Well, there's lasers that can help decrease that.
Mm-hmm.
And now I saw the other day there's a laser that you can be used on any color of skin. I know that people that have African American or black skin or Asian or like a Hawaiian or an Indian skin, they've had difficulty with some of the lasers, the IPL lasers, because it can bleach the skin, it can make splotchiness, or it just doesn't work.
Mm-hmm.
So now they're starting to find lasers that actually work. I'm not versed in it yet. I think coming out, there will be more and more laser procedures that you can use for darker skin.
That's going to be your next research.
I'll have to do the research and help you out with that one.
Yeah.
Because then if you do a procedure, maybe you follow up with like a med spa laser treatment to get rid of the scar.
Yeah.
Scar will never go away 100%, but at least it could definitely make it so it's less...
Like it faded out.
It fades it out, yes.
Yeah.
Make sure that whatever doctor you have...
Mm-hmm.
So let's say you're going to a plastic surgeon nearby, that they also have hospital privileges near you as well.
Mm-hmm.
Because you may have to go to the emergency room after the procedure. Just realize that. And you want to make sure that your plastic surgeon can come to the hospital that you are closest to. That's why a lot of people will not go. Some people go out of the state to get plastic surgery, but then they regret it because if they have to go to the hospital, they can't have their plastic surgeon check on them.
Yeah.
So.
Oh, those are things you have to think about.
Yeah. There's some sites out there too. You know how like when you go to a restaurant, there's like a Yelp to review the restaurant. So doctors get reviewed on, it's called Health Grades. I've seen that as well as Google.
Oh, really?
Google I've seen faked a little bit more, but Health Grades not so much.
Mm-hmm.
So if you want to go look up a doctor and see how other people... Now, remember, some doctors have bad reviews because most people will give a bad review before they'll give a good one.
Right.
So just take it with a grain of salt. But if a doctor has a lot of great reviews, maybe they are a good doctor.
You are right.
But just because they were good with everybody else doesn't mean they're going to be good with you.
Right. You see, we all are individual.
Mm-hmm.
Yeah, I have to think about that too.
You can kind of tell when you go in to meet with a doctor if they're nice to you and if they listen to you. If they talk over you or they dismiss your questions or concerns or they want to quickly move through the procedure and don't really want to take what you have to say into consideration, that's probably not a good fit.
No.
That means they're just too busy and you're just a number to them.
You put your life in their hands. They better listen to you.
Yeah, and you need to make sure that the anesthesiologist is licensed too because they're the ones putting you under for these procedures.
That's true.
You need to be concerned with all of that.
Yeah. So you have a before and after checkup too, I think.
You usually have multiple ones.
Yeah, you have to have post-op.
The post-op checkups are great. So here's what a doctor has to do. They have to go for undergraduate degree. Every doctor does.
Right.
And then they all go to medical school.
Mm-hmm.
So by the time they get to you, they've probably had 15 years of experience.
Yes.
They have to do residency in general surgery typically, so they should know.
Mm-hmm.
And this is a surgeon that gets licensed and certified, right?
Mm-hmm.
And then a plastic surgeon also has a fellowship.
Right.
Now, there was one that said that a lot of doctors that go into plastic surgery were in dental for a while, too.
They are?
Some of them have been in dental. So they went from dental to
be a
plastics, which
plastic
I don't
surgeon.
like. I want them to specialize in plastics and get really good.
Yeah.
And then they also have to, if they're licensed, they have to keep their continuing education up, just like we do in all of our other licensed careers.
Mm-hmm.
So I know I have to in my other careers. Every couple of years, I have to do my continuing education.
I think the doctor, they have to do every year.
Is it every year?
Yeah, they have to do every year.
Well, it's good. There's so many different people that you deal with when you go in, right? So you're going to deal with the plastic surgeon. You're going to have the anesthesiologist. You have to make sure they are good.
Right.
One of the big complications I've heard that people have is when they have an issue with anesthesia.
Anesthesia is a big thing.
It is. And if you have other health conditions, make sure you tell them because that could impact the anesthesia.
Yeah.
If you have a liver condition, if you have a heart condition, if you have a kidney condition, even if you're diabetic, you could have issues with anesthesia.
Anesthesia is the first step of surgery. You got to remember that.
It is. And if you've had problems with anesthesia in the past, you really need to let them know. I don't care how bad you want that procedure.
Right. So you need to. They're the first person to touch you.
They are.
Yeah.
And then you're going to have nurses. I think it's important to have a good nurse as a good doctor.
And the nurse. Nurse does most of the work.
They do. They're checking in on you. If you don't like the nurses, it's probably a bad sign that you're not going to like the doctor. So if there's any plastic surgeons out there listening to this podcast, hire better nurses because that's very important to people.
Yeah. The guy that did my eyes, he has 2 people. The first one, this lady, all she does is just comfort you. She talk to you. She's listen to your problem. And then he has a nurse by his side while he was doing the procedure.
Yeah. So was it a physician's assistant or was it a nurse?
The first one was a physician assistant and the second one is a nurse.
And there's even nurse practitioners that'll get pulled in sometimes too.
Yeah. Mm-hmm.
All these different medical terms, I kind of know from just basically going to the doctor, but I haven't gone through any plastic surgery. But
I know from, that size of family, but I know all different nurses, they get different training. Like the nurse in OR, they get different training. If you're going to be a nurse or plastic surgeon, they all get different training.
And the nurse has usually a better bedside manner.
Yeah, they're the one who deal with you directly, actually. Mm-hmm.
There's medical salespeople or medical consultants too that come in. They're the ones that try to upsell you.
Yeah.
I want you to realize that you are your only advocate. So if somebody comes in and tries to sell you on a procedure that you do not want, don't do it. Know what you want before you go in. You can listen to their advice, but don't make a decision right then.
I would do all my research.
Do your research first. And don't select the first plastic surgeon. I had a friend that did a tummy tuck. And she interviewed like 6 or 7 plastic surgeons before she selected one.
Of course.
And a couple of them, and the thing is what she wanted done actually evolved over time because she was just going to go on for a tummy tuck. And then she realized her stomach was split, so she needed to stitch up her stomach. And then one of the plastic surgeons said, well, you should probably go all the way around because you got a lot of saggy skin in your back. And she decided to do that as well. And that was her choice. But one of the plastic surgeons says, oh, we just need to do liposuction for you and do a little bit of nip here and you'll be fine. And she didn't like that. And that's what she originally thought she was going to do. But when she went to the other plastic surgeon that showed the difference that a full 360 would do with the liposuction, et cetera, and the stitching, she liked that results the most. And she liked his bedside manner the most.
See, it's how you have to interview all of them.
You do. And
as much you could anyway.
And there were other places that were closer to her house and et cetera, but she did not like the personalities of some of the doctors.
Oh, well, how about price-wise? You can't go cheap for that one.
She actually got it all done for, I think it was right around $10,000.
Is it really?
She got the full 360, the liposuction, the tummy tuck, the belly button moved, and the stomach stitched for $10,000.
Huh. That's less than a car.
Yeah, it was like $10,000 and a little change. But it was, and then she financed it. So let's talk a little bit about that.
They even finance it with 0%?
They do. So there's a couple things that have been going on in the med spa arena as well as the plastic surgery arena. A lot of these companies have partnered with banks that will do 0% or a very low percentage, depending on your credit score, etc. And what they'll do is they will split the procedure out over 12 months to 5 years, and you can do monthly payments. So let's say it's $10,000 and you want to pay it off in a year. It's going to be like $800 a month, right? Something like that. 800 and change a month.
Right.
You could pay $800 and change a month. Now, when you sign up for these, because I've actually signed up for one because I was like 0% financing, can't beat it. So I know when you sign up for these, they're going to run a full credit check. So it is going to ding your credit. Then you get to pick which payment plan you want. And here's how they kind of get you. They show you the payment plan for 0% that you pay off in 12 months.
Okay.
Then they say, oh, for 2.9%, you can pay it off in 24 months. And then for 6.9%, you can pay it off in 3 years or something like that. And they go up from there. And
the interest is going to be more than your own.
Well, eventually the interest, it adds up. I mean, they go all the way up to 20% if you wanted to go for 5 years or something like that. But they show you the monthly payment. And I think a lot of people, I can afford that monthly payment easier.
Just like buying a car.
Just like buying a car. Oh, if I do it after 5 years, it's better. It's so much more affordable than doing it for one. I've always done the one just so I can get paid off and I get the 0%. Oh, you have to be careful not to click the wrong box.
Right.
To get a longer payment plan, and then you also get an interest rate that's higher. So that you have to, when you fill out the application, you go slow. Okay. Because I once checked the wrong box and I had to cancel that loan and redo a new one. So just a heads up. Then on top of it, let's say you get the 0% financing. If you are 1 day late, your interest jumps up to maybe 20%.
Wow.
So realize that if you are 1 day late, those 0% offers, and that's the same thing sometimes on buying a car. If you are a day late,
it's the same with the car.
The interest is going to go astronomically high.
Right.
And a lot of people are late paying their bills.
If I were going to do that, I would have them set up taking that right out from my checking account.
Actually, the way I do it is I have set it up so I do payments every 2 weeks, so nothing ever gets missed. Or you could do a payment every 3 weeks, right? So you're getting extra payments. I always pay it off early. You got to set it up so it's an automatic debit.
But I didn't know plastic surgery have finance available.
Plastic surgery has finance. That's how most people do it. And then you set it up. Now, if you're going to use a credit card to pay it, because some people say, "Ooh, I'd like to use a credit card." A lot of times these banks will charge you 3% interest or 3% on the price when you're using a credit card. It's called a credit card transaction fee. So even though you think you got 0%, you're also paying 3% for every processing transaction.
Wow.
So that's how the financing works. So that's kind of the back end story of the financing. So if you want to go and you want to have $40,000 worth of procedures done, because we've kind of told you the pricing on all these things, you can go have $40,000 of procedures and finance the whole thing.
Wow.
Yeah, you don't have to pay it off right away.
So, buying a car.
It's like buying a car, but you're buying a face or you're buying a body.
Yeah. You probably be more happier.
Yeah, you might. You might. It might give you confidence that maybe you make more money because of it. Maybe you have a scar that you have some type of scar tissue on your face or something that makes you feel insecure about yourself and you go have it done and now you're making more money and it's a good thing for you.
Yeah, that's something to think about.
It is. But you do have to set realistic expectations.
That's true.
Because I think some people think I'm going to go in and get this plastic surgery done and my whole life is going to change. And it doesn't.
That's going to be me because I'm going to be a cocky.
You're going to be a cocky what? B-I-T-C-H?
B-I-T-C-A. And my S-H-T don't stink now.
Her shit don't stink. She can say shit. It's okay.
Yeah.
That's
going to be my personality, I think.
No, you wouldn't get that cocky. You're too lovable.
I don't know.
I do encourage you to set realistic expectations. Always go with multiple opinions and don't take the cheapest one, just like Diva Cat said.
Yeah, no, you get what you pay for. I always believe in that. And my mother always tell me since day one, you get what you pay for, even the food you eat.
I have heard of people, they go in for plastic surgery. They pick their doctor and their doctor has an emergency and they get sick or they have a family emergency and they have to go away. And they try to have someone step in.
Oh, no.
Never accept that. If they have to reschedule your surgery, reschedule it.
Yes.
Keep your doctor. Because typically the person that steps in is somebody that's in training. And you don't want to be someone's experiment. You know what I mean? You don't want to be the one person that they're learning off of.
Yeah, when I had my knee surgery, that's just for my knee, my from the ski accident, my ACL reconstruct. I talked to 5 different orthopedic surgeons.
Did you?
Mm-hmm.
That's a lot.
Yeah, I decided with the first one.
With the first doctor?
Yeah.
And why did you pick that first doctor?
He's very thrilled and I feel comfort with him.
Yeah.
And he walked through my whole procedure. He takes time to walk through my whole procedure. The other have a nurse come talk to me. I don't want no nurse talk to me.
Exactly.
No.
That's the thing that my friend who had the tummy tuck done, she said the same thing. They walked through the whole procedure with her. They spent a lot of time with her and made sure she felt comfortable.
Yeah.
The doctor, not the nurses.
Not the nurses, no. I mean, he has the nurses behind him, talk to us. But he's the one who talked to me directly.
Yeah, I think AI is going to change some of this stuff, but the human-to-human contact is going to be so crucial in the medical field going forward. We don't want to hear from the nurses.
No, we don't want to hear from nurses.
We want to hear from the doctor that's going to be cutting into us.
Yes. And I know most of the time the nurse probably close you up, but the one that cut me, they better be talking to me.
The one that closes me up better be the doctor. Because that's where you get your scar from, right?
Yeah.
So I want the one cutting me and closing me up to be the doctor.
Yeah, that's why when I had my eyes done, I know the whole thing what goes on in the room.
Oh, yeah.
Yeah. And he's talking to me the whole time. He turned on, he said, what kind of music you want to hear?
Oh, that's nice.
Yeah. Yeah.
I want classical. It's best for healing.
Yeah.
Or do some binaural beats or something like that.
No, I do the yoga one.
Oh, did you?
I do the one from DJ something. He has the whole playlist.
Yeah.
Yeah. It was very soothing.
Well, let's now talk about people that travel overseas to have all these procedures done.
I've heard a lot lately.
And you know why, right?
It's cheap.
It's cheaper. That's the number one reason. Some people say it's shorter wait times, but for Pete's sakes, here it's like a month to 2 months. You're not waiting a long time typically for a procedure. It's really because it's cheaper.
My own brother did his eye overseas.
Did he? Well, and a lot of times it's all inclusive.
It is all. That's the key. That's all inclusive.
As long as you get there on an airplane, they will pay for your hotel.
Yeah.
They will keep you there until like your drains are out, right? Or if you don't have drains, they'll keep you there for a week to recover.
Yeah, both you and your caretaker.
And they'll provide meals and transportation. And it's kind of like a 5-star hotel.
Yeah, it's like a resort in there. They have everything in there.
Some people go to Thailand. They go to different places. Increasingly, Mexico is one of them too. I've heard Turkey, but I've heard some bad things about Turkey.
Is it really?
Yeah, I heard somebody went to Turkey to get some plastic surgery done and they lost their kidneys or one of their kidneys. They came back without a kidney. They had a tummy tuck and one of their kidneys got taken out and sold. They don't have the same requirements we have here. So you got to be careful when you go to different places. But here's the top places that people go. They go to Mexico. They go to Turkey. Turkey's super cheap. And I've heard they've got some really good Turkish surgeons. You just have to be careful where you go.
So Mexico, you come back with 1 kidney or 2 kidneys?
Mexico. So the problem I don't like about Mexico is you go to Mexico, you might have a really good up and up Mexico facility and have the surgery. However, I've heard stories, and this is hearsay, but I've heard stories about people having a problem, having to go to a regular Mexican hospital that doesn't take your insurance.
Oh, wow.
And then they won't release you until you pay $15,000, $20,000, $30,000 hospital bill, because they bill you at a U.S. rate. They're not billing you at the Mexican rate.
And how do you know it's not a setup?
And how do you know it's not set up? And what you need to do is you need to get insurance for that country's hospital before you go.
Wow.
So that's something you should do. If you're going to go have surgery in another country, sign up for their health insurance that covers hospital visits. It can be like, some type of extreme care or something, It doesn't have to be like full coverage. It just has to be in case of emergency hospital care.
Yeah.
That way, they'll let you go.
I personally know 2 persons that went to Korea, did the whole thing.
Korea's one.
Yeah.
Brazil.
Is it really?
People have been going to Brazil. People have gone to Panama for procedures. I did stem cells in Panama. Colombia's one. A lot of people have gone to Colombia and Brazil for the butt lifts, actually.
Oh, wow.
And then we did say Thailand. Dominican Republic is huge. South Korea is a big one, but South Korea is not that much cheaper. So you have to realize South Korea is not a cheap way to go, but they do a really good job.
Really?
They do a good job in South Korea and in Thailand. Yeah.
Yeah, I seen the result from both South Korea and Thailand. In Thailand, for $15,000, you have your whole 360.
Yeah.
You check in a day before.
Yep.
And you won't check out till 10 days after.
There you go.
For you and your caretaker.
So for $15,000 in Thailand, you're getting the full stomach tuck, but you can do that for 10 here in the U.S.
Yeah, but you don't get a caretaker. You come home with that bulb hanging up your belly.
No, because you can do the drainless. You can do the drainless.
Oh, okay.
Yeah. But I mean, if you wanted to stay here, maybe you could pay a couple grand a day if you wanted to, because by the time you go over there, there is the risk of having complications.
Or if I were to do anything, I would do right here by the house. Oh, yeah. I would never go out of country. Never.
Yeah. And some people go to Canada. I've seen that too. I've seen a lot of doctors advertising their services on Instagram lately, and they'll have videos of the before procedure and after procedure, which is kind of interesting. When it's a video, it's less likely to be filtered, although you can filter those too. But the videos are nice to kind of watch the before and after pictures of the procedure.
Oh, wow. I don't know. If I'm going to do something, I think I prefer to do right here.
Yeah. Well, can do it here, but sometimes there's procedures they do in other countries you can't have done here.
It's illegal here.
Some procedures are not allowed here. Like, for instance, the stem cells that I did. I know that's not plastic surgery, but they don't do IV stem cells in the United States.
Even now, they still don't do it?
They don't allow it. You can do injections into joints, but you can't do an IV.
Yeah. So, that's a two different thing. That's what I want to do with my knees. The injection to my knees because of my cartilage is gone.
Oh, yeah. You can do that with PRP, or you can do it with stem cells. You can also do soft wave tissue on that too, or soft wave. So here's the typical savings. All right, I got a table for you.
That was I was going to ask.
How much do you save? Yeah. Okay. Typically, breast implants or breast augmentations are going to cost $7,500 in the U.S.
Okay.
You're going to save $3,500 to $5,000 if you go overseas. Now, you're still going to have to pay for your flight.
Right.
So it depends on, you might spend $1,000 on your flight, but the average cost overseas for breast is $2,500 to $4,000.
Plus the flight to get there.
Plus the flight.
Okay.
Okay. Now, remember, breasts are a little sensitive because if you have a rupture, you can't go back to your plastic surgeon. So be careful if you're doing a breast implant. Right. Tummy tucks in the U.S. typically cost 10 grand. All right. If you go overseas, it's typically $3,500 to $6,000.
Plus the flight.
Plus the flight. So you're saving $4,000 to $6,500, depending. And here's the thing, you're probably only saving $4,000. Because prices have come up in these other countries too.
Yeah.
So you're saving $4,000. You're going to spend $1,000 or so on the flight.
Yeah.
And you run the risk. So you're basically going to save $3,000. Do you really want to deal with it?
Right.
Brazilian butt lift is one of the bigger savers, right? So it's $12,000 in the U.S. And in some places don't do them anymore because of all the infections that have occurred. And the average cost abroad is $3,000 to $5,500.
Oh, wow.
And here's the thing, different parts of the world do better at certain parts of plastic surgery. Like South Korea does great with facelifts.
Right.
And probably Brazil does a great job with the Brazilian butt lift.
Right.
So you want to go kind of where they do procedure, just like you want to pick the plastic surgeon that does the best job.
I know. I've heard Mexico did good job on the tummy tuck.
Probably.
Dominican Republic.
Yeah. I just want to keep my kidneys.
You might come back with no kidneys.
I want to make sure that they don't sell off parts of my organs or cut half of my liver in half and sell half of my liver.
Yeah, you probably come back with like one kidney, a quarter of liver, and no more gallbladder.
Yeah.
Yeah, no.
Yeah. Well, gallbladders aren't really for sale, but the kidneys and the livers, definitely. Although they don't want mine. They're like, you keep your liver.
Right.
And then there's like the nose lifts. So nose lifts in the U.S. typically cost $9,000.
In here?
In the United States. Nose lifts are a big procedure because they have to restructure the bone and everything. So in other countries, they tend to be $2,000 to $4,000. So that's a big savings there too.
You know, South Korea is a big thing about the nose.
Everything on the face for South Korea, they're big on.
Yeah.
And then the full facelift typically in the U.S. is $15,000. Like if you do everything.
Wow.
Face, jaw, neck. $15,000, whereas abroad you can get it done for $4,000 to $7,000. So you might save $8,000 to $10,000 there.
Now, how painful are we talking, like recovery here with all these procedures?
Well, I don't know how liberal they are with drugs in other countries.
It's true.
They might give you more drugs, and I know you like your drugs.
Unlimited
drugs. I don't know, but I wouldn't go to another country for a procedure unless you know what you're getting yourself into. There's so many risks related to it. Even going to another state, unless you know what you're getting into, I would stay local. I would stay within 2 to 3 hours of your house.
Not even that. I think other countries good for vacation.
It is. Now, if you have family in another country, they've done the procedures with those doctors and they were okay, then maybe it's something you could consider. Here's the other thing. If I go to South Korea, they're used to working on South Korean women, and South Korean women's faces are differently structured than a Scottish face.
So you might come back look like Korean.
I might come back looking more Korean. They might tighten up where I didn't expect them to tighten up, and they did it because that's what they're used to doing. So you need to realize that maybe if you are South Korean, you might get better results in South Korea than you do in Alabama.
Yeah.
Right? You may get better results if you go to where you're ethnically, culturally more like.
Yeah, I know in Asian community, Thailand and South Korea is a huge.
Yeah.
People go there.
And probably if you're Hispanic, you might go to Mexico or Brazil or Colombia. Right? So those might be the choices. Maybe if you're Muslim, you go to Turkey and you don't have any fears of it. You just have to remember there was a whole group of women that went to Turkey to have their tummy tucks done, and they all came back missing kidneys. Every single one of them. They went to some shady place, and it was on the news, and they all came back missing a kidney. And they just sold their kidneys off. So just realize there's risks when you go to other countries. Now, I'm not saying that has never happened in the United States. I don't know if it has or not. But I've never heard of it happening in the U.S.
I want to keep both of my kidney. I'll stay right here locally.
Yeah. Hence, again, why not to go cheap?
Right? That's another thing, you know?
Yeah. And then in other countries, you don't know what their medical regulations are.
Yeah.
You don't know how clean it is. You don't know how sanitary it is. They could be using dirty stuff and you don't even know. And the surgeons don't have the similar licenses as we do, that they might have nurses that don't have similar license. And they have places over there that are called surgery mills. It's all about processing the numbers. That's why it's so much cheaper.
I'll tell you why. The place that my brother did his eyelid, that's all they do. Eyelid all day. Hours on the hours.
Oh, yeah.
The whole time.
Yeah. They just process you quickly, right? And then what happens if you have complications? Like, let's say you have a blood clot or you have, I don't know, a hematoma or the procedure's botched. Because a lot of times you don't see the final procedure until the swelling goes away.
I know.
Now you got to go back again.
Right. And they don't even do like health clearance. Like before I did my eyes, you got to go to a doctor, check your heart, all of that. What if something happened in the middle of it? You know?
And if you have an emergency, you may end up paying more because you have to go to the hospital. Even if you have emergency care insurance, you may end up still going to the hospital and paying more than you would here.
And one kidney left.
Well, let's say that they don't take your kidneys. Let's hope for the best.
Right.
But let's say that you have a blood clot. Now you have to go to the emergency room.
Get it.
And your catastrophic care health insurance covers the basics at the hospital, but you still have to pay $4,000 or $5,000. Now you're actually paying more than if you had it here. I'm not saying you can't do it in other countries. I'm just saying weigh your options.
Right.
And then if you don't speak the language.
Forget it.
And you're trying to talk to a doctor that doesn't speak English, if you only speak English, because a lot of U.S. citizens only speak English, then you could have a problem. Again, you might want to go, if you're going to go, you might want to go to a country where you speak the same language.
That's the key.
And here's my big thing. If you're traveling, you have a higher chance of blood clots when you fly.
Yes.
So you go there, you're there for a week or 10 days. What happens when you fly back and you have a blood clot?
No, forget it.
There's risk.
There's risk, no.
And what happens if the wound gets infected or the scar looks really bad? You don't really get the follow-up.
No.
And a lot of the local surgeons in the U.S., or if you're in Europe or in the UK, they will treat you for follow-up if you have a complication.
Yes, they do.
And it's a lot of times it's included in the initial cost.
Yeah. No, I think I prefer if I were going to do it. If I don't have money to do locally, then I would not do it.
Yeah. So here was one of the things that happened before, too. And I think it was during the pandemic or 2022 or 2023, somewhere in there, they had an outbreak of tuberculosis bacteria. So TB.
Oh, wow.
In people that came back from the Dominican Republic and Mexico that had surgery there because they were using non-sterile something and they came back and they had TB.
Huh.
So you could catch a disease not even related to this. You have to realize that. And you're also going to be on antibiotics for a while. You could have disfigurement issues if you're not careful. So just research. And I say research local as well as research in other countries. There's just going to be a lot more research if you're going international.
No.
Take care of yourself. Make sure you're protected. And there's international organizations as well. You can look up plastic surgeons on too. And there's like, if you're going to go do it in Turkey, there should be like a Turkey place to look up the surgeons too.
Mm-hmm. Don't you have a website? Globally to look at
there's I don't know, there might be a global website, but I would say plan on spending a month there.
I would.
And then if you think about it, if you were, now you're taking a month off of work instead of just a couple weeks.
So you don't really save anything.
You may not save anything at all.
No. Here you just go there, a week later you go back to work.
Yeah. So you could think, oh, I'm going to save $4,000. But sometimes when you pinch pennies like that, it's like what do they call it? A penny wise, a pound foolish?
Yes.
So you're actually losing money because of all the possible side effects or complications or things that can go wrong when you go internationally. I recommend staying within 2 to 3 hours of your home. And the only reason I say 2 to 3 hours is sometimes people live rurally and maybe they'll go to a big city to have it done, which is understandable. But even 2 to 3 hours away, if you want, you can typically go home a couple days later.
Yeah.
And recover in your own home, which I think is less stressful too.
Yeah. I think 3 hours a max.
Well, it depends. I mean, there's people in Colorado and Wyoming that might have to drive 5 hours to get anywhere.
That's true.
Just go to somewhere in your state, or if you're going to go out of state, that you do a lot of research.
Right.
Or if you're going to, like, maybe your family or friends have a place and they're going to take care of you, that's fine too.
I agree.
So what's your first procedure going to be?
Yeah, now that we talked about dig deep
now
all
she's
this
scared.
research, and I think I'm good where I am right now.
Now Diva Cat's like, well, I was thinking about doing it. I was ready at the beginning of the podcast, and now I'm not thinking about it anymore.
I think right now I'm okay.
Well, remember, typically you don't have your kidney disappear. Typically you don't get TB. Typically you're not going international. Typically you're going to be able to handle whatever comes your way.
I don't know. I can't take pain that much. I'm not.
It's funny. People think that it's going to be that painful, but they're so drugged out of it when they get done with their procedure. They don't even remember the pain.
Do you know, I still remember the pain, the C-section. You know how the next day they make you get up?
Yeah.
I still remember that pain.
Do you?
Yes.
Yeah, so do I. I actually got released in the hospital the day after both of my C-sections.
I know. They send you home.
Yeah. And then I was like walking. I was doing everything. I was lifting a heavy bag. I had to do it because
yeah,
that's a whole nother story.
I still remember that pain. I am, now that I'm thinking of it, and now we dig deep about the cut and the sore. I think I'm good for now. No.
All right, well, then I'll go first.
Yeah, you go first. Okay, I'll take care of you.
Yeah, but it's not going to work that well. You know why? Because I have a really good pain tolerance. You'll be like, oh, it's been 3 days and she's back to work.
Yeah.
And I should be able to do that too. And then Diva Cat does it, and she's like 2 months later, oh, I'm finally getting back to work.
You have gallbladder attack, and next thing you know, you're like, oh, I'm good.
I'm good. I got it.
It's
handled.
Yeah, no, I don't know. I could judging by you. No.
Well, I think you can handle it.
You think so?
I'll help you.
Okay.
Yeah, I'll take care of you if you want me to.
I told you, I still remember the pain of the C-section.
I don't think this is as big of a deal as a C-section. And when you get a C-section, they don't give you drugs like they do this. Because when you get a C-section, most people are breastfeeding.
Oh.
So you have less medication. They don't want the medication to pass over through the milk to the baby.
Now that I'm thinking of it, I didn't have any.
Yeah, you get a little bit right after, and then you're done.
Yeah, when your IV full up, and that's it. Now that I'm thinking of that.
They might give you like ibuprofen or something like that, something that doesn't cross over, but they're not giving you a bunch of medications when you're breastfeeding. If you weren't breastfeeding, maybe they did, but I was breastfeeding. They didn't give me a bunch of pain meds.
I don't know. I still remember my knee surgery when he pulled that thing out from my knee, that too.
Yeah, well.
Yeah, no.
That was different too. See, for me, they couldn't even give me pain meds because my blood pressure kept dropping so low that they couldn't give me any pain meds.
Yeah, but you could take pain. I can, no?
Yeah, and my blood pressure stays low when I'm in pain.
That's why I don't get it.
I actually get to normal blood pressure when I'm in full labor. I'm in labor and I get normal blood pressure. That's my thing.
Maybe you need to eat steak more.
That's a whole nother conversation.
Right.
Yes. So I think we covered the full gambit today on plastic surgery.
I think so.
We went from facelifts to body lifts to international travel.
Yes.
And how to find your right doctor. I hope that this was beneficial for you.
Yes, I hope so too. I hope you rethink about if you're going to go overseas to do it.
Yeah, I'm a little nervous about the overseas.
Yeah, me too.
And I think that with less people traveling overseas, sometimes they get even more desperate for money. So you have to be careful with that.
Yes, they could be set you up with the hospital. You don't know.
Yes, there can be scams involved.
Yeah.
And when they see, and there's some people who've even gotten kidnapped when they go overseas.
That's what I'm saying. I hope you rethink about it.
Just rethink about when you go overseas, because you could be a target.
Yeah, for sure.
You're also away from home, all by yourself potentially, or with just a caregiver, and you might be missing your family as well.
Yes.
I would like to be home.
Yes, me too.
This is Diva Mia.
This is Diva Cat.
We're telling you, stay strong, figure out what you want first, love yourself no matter what, and do this for you.
That's it. Stay healthy.
Take care and have a great week.
You too, Diva Mia.
All right, Diva Cat.
Thanks for tuning in. Like, subscribe, and drop a comment. We love hearing from you. Visit thedivadetails.com to connect. See you next week for more.
Diva Details podcast and website are intended solely for informational and entertainment purposes. The content provided does not constitute professional, medical, financial, or legal advice. We are not licensed medical practitioners, financial advisors, or legal professionals. Always consult with a qualified healthcare provider for medical advice, diagnosis, or treatment. Any financial topics discussed are based on personal opinions and experience and should not be considered professional advice. The content provided does not constitute legal advice. The Diva Details and its affiliate contributors and guests are not liable for any losses or damages arising from the use of our content. The opinions expressed in the podcast are solely those of the speakers and do not necessarily reflect the views of any affiliated organization, sponsors, or partner. All facts discussed in the podcast are researched and accurate to the best of our knowledge at the time of recording. Information may change over time. No guarantees are made regarding the accuracy, completeness, or reliability of any statements or opinions presented. It is the responsibility of the listener to verify any and all facts that may influence their decision. This podcast is for information and entertainment purposes only and should not be considered professional advice.